And this is a gentleman called Dr. Josephat Nuzagi, the Upper East Regional Director of Health Services. That's him. And is hailed from Class FM Online. Run the story. It's sad. Now, the Upper West Regional Health Administration has reported that about 80% of doctors allocated to the region for the 2025-2026 service period did not report to duty. Over 80%. Now, the administration said 25 out of the 32 doctors allocated to the region not accepting to the posting have left a huge gap in the medical workforce. Dr. Josephat Nuzagi, the Upper West Regional Director of Health Services, bemoaned the development, forecasting it would have a huge negative impact on the quality of healthcare available to a region with nearly 1 million residents.
Therefore, 2025-2026 posting of doctors now what you will and a course. So you're posting doctors be na various regions. Now, the air trading say doctors are your post to Upper West region. Therefore, obviously there be any idea on mobile. So Oman report to Eduma. I die was on Mokon, therefore Oman co. We na health minister, Honorable Minta Akando, therefore Waba out. I send this strong warning to doctors now. You're supposed to move to some rural areas, some saving cross in those kind of things. Normal person will come. Therefore, 1 week say Omunko and yes sir. Therefore, and yes sir. The Black Rasta of Black Empire Media, it won't treat you more like Black Rasta were pilot because they never as a doctor, medical doctor, you're supposed to also the heavy baby are supposed to remain pen. DNT and the Basa. So therefore Black Rasta won't teach you of a camel. Now Yakuti in some Black Rasta attitude that ever doctors you and ever on my Ghana and a politician in general. Aha, Zinga TV.
Yes, the voice of the people, and the voice of the people is the voice of God. Now here we don't criticize, and if we must criticize just on one condition, we would only criticize to build and not to destroy. This age-old bad Ghana sickness must end. My brother, my sister, Ghana has a number of diseases, like many other countries in Africa and beyond. We are always late at events. The most important people never arrive on time, because for them, if they arrive on time, it reduces their quality and their levels in societal standing. But today we are not looking at time. We are looking at something that is killing us. I came across a publication, My Joy Online. Doctors that we train in this country posted to the same country, but they refuse to go. It broke my heart. It's not a joke, my brother. Now the doctor's creed is that he will do everything humanly possible to save lives. Nurses also follow the example of Florence Nightingale. My brother, my sister, doctors have been posted to the Upper West region of Ghana, and over 80% of them have refused to go. Watch this from Ghana World. 80% of doctors posted to Upper West
Zinga TV
didn't show up for duty. And this is a gentleman called Dr. Josephat Nuzagi, the Upper East Regional Director of Health Services. That's him. And is hailed from Class FM Online. Run the story. It's sad. Now, the Upper West Regional Health Administration has reported that about 80% of doctors allocated to the region for the 2025-2026 service period did not report to duty. Over 80%. Now, the administration said 25 out of the 32 doctors allocated to the region not accepting to the posting have left a huge gap in the medical workforce. Dr. Josephat Nyuzagi, the Upper West Regional Director of Health Services, bemoaned the development, forecasting it would have a huge negative impact on the quality of healthcare available to a region with nearly 1 million residents. Dash it away. Hold it there, hold it, bring it back. Now look at the last paragraph. It's most important. Joy News reports that there are only 55 active medical doctors in the region. The whole of the Upper West region, only 55 active doctors. Meaning, each has to attend to a staggering 18,181 patients. Dash it away. One doctor to over 18,000 patients. In America, what is the doctor-patient ratio? 1:10 or less in some situations. In England, it's almost the same. In our country, 1 is to over 18,000. That means one doctor is responsible for taking over 18,000 patients under his wings in terms of their health. That is why misdiagnosis can start. That is why a lot of patients will run out for the doctors and they treat patients badly. It's not an excuse to do that though. A lot of doctors are overworked. How much does it cost to train a doctor in Ghana? In 2012, there was this statistics that came out that in the public sector, public schools, it took about $6,000 annually to take care of doctors for the 6 years of training. So 6 times 6 is what? 36,000 American dollars. As to why it's quoted in American dollars, your guess is as good as mine. If they are not able to make it to the public schools, or they just prefer to go to the private schools, they pay twice, 12,000 American dollars annually. 12 times 6 is what? 72, isn't it? 72,000 American dollars. How many people can afford this? The nation subsidizes the training of doctors in our country. And after they are trained, they refuse to serve their own people. And a lot of this is because they claim that where they are posted to, facilities are very bad. They are used to air conditioners. They are used to jacuzzis. Therefore, if you send them to villages where there's no electricity, they wouldn't want to go there. They prefer to go to England to take care of people who never contributed jack to their training, to going to serve their people, because there's no air conditioning, no electricity. In England, there's everything. How do we grow as a nation? Do you know what made Florence Nightingale? She sacrificed everything to be able to see lives thrive in the healthcare sector. And we have more examples we can give you. Mother Teresa. Look at her achievements. Even the father of medicine, my brother, my sister, what was his life like? To be a health worker is to have the spirit of sacrifice. If you don't have that, don't try. But the health minister is very angry, and he has sent a stern warning to the people there. His name is Kobna Minta Akando. He's angry. He has given them time to report, or else something will happen. Minta Akando issues 1 week ultimatum to newly posted doctors to report to work. 1 week. And this was published just today, the 3rd of December. Run the story. The refusal of newly deployed doctors to take up their postings has prompted the Minister of Health, Kobna Minta Akando, to issue a 1 week ultimatum for them to report to their assigned facilities. Akando described the initial turnout as not encouraging, disclosing that about 70% of newly posted medical officers nationwide have failed to report. Regions struggling with severe staffing gaps, including the Upper West and Upper East, had no arrivals as of the 28th of November 2025. Listen to this. The man in the Upper West region says about 80% has not reported. Akando said this is even worse. As of the 28th of November, last week, 0. Nobody even went to those areas, Upper East and Upper West. And these are some of the most deprived places we have in Ghana. My brother, my sister, dash it away. Remember when we told you the way we treat our nurses and doctors? A lot of them are running to England and America to do things that is not very honorable. Yes, things that are not honorable at all. How can a doctor go to England or America and is relegated to cleaning an old man day in and day out, and they call it healthcare? Here we have people who can do that, and they don't even have any medical training. You go with all the medical training you have, and you are underemployed, but as long as you are making the money, you have no problem. Are we truly independent, or we are jokers? How many doctors will be proud to say that, you know what, I studied in Accra, I also even went to England, I've been posted to go all the way to Salaga or Pesingpe to go and work. It's a new learning curve for me. It's going to be nice. But no, a lot of our doctors are not going to serve. They want to be served. And this is sad. It is killing us. A lot of the hospitals, you see nurses working as doctors. True or false? Professionalism, most of the time, is thrown to the dogs. How will the nation grow? A sound mind is in a sound body. So if the body is not sound, how do you have a sound mind? Mens sano, corpore sano. The Latin saying goes. The Latin saying goes. My brother, my sister, this is the biggest problem we have with our health sector. They all want to go abroad, fly to America, fly to England, and do things. I'm glad what Akando is doing. But what next if they refuse to go? What is Akando going to do? He's going to sack them? They will be happy to be sacked, so they will go to America or England. We have to devise a better way of retaining our doctors and nurses. Only patriotism can do that, not force. Not force. It's so expensive to train doctors. To start issuing them commands and warnings. It's better to start on the true and real tenets of the profession. Sacrifice, patriotism. Every doctor wants to make money. They want to ride the biggest cars. That is not your calling. The cars will come naturally. The big houses will come naturally. One patient can buy you a train. That's if you have rails to run your train on. I'm speaking tongue in cheek. One patient can buy you a private jet.
Please
the private
subscribe, comment, and share for more content.
In his 8 years of kingship and dictatorship. Let's be serious for once. Doctors refuse posting to the Upper West region as if it's not human beings who are there. Meanwhile, you are trained to take care of human beings. If you are trained as a cowboy, do you want to go and take care of cows in the White House? There are no cows in the White House. The cows are in the ranches. That's where you go. Your duty as a doctor is to go to the hinterlands and take care of people. You are not a king. Why are you pretending to be a king? That's not your calling. Then better be a politician. Start stealing our money, then we can worship you. It's sad. Many people are dying. Diseases all over the place. All because our citizens have let us down. They are lording it on us. We can't continue like that. If I'm wrong, tell me I'm wrong. Can you do this in England? That a doctor has been posted to a certain area that is a little deprived or even deprived. We see Doctors Without Borders. They go into earthquake zones, tsunami zones. In the eye of the storm, they work. Are you different from them? Learn to sacrifice, brethren. What happened to your reward is in heaven. That teachers have wound around their necks like albatrosses. As for doctors, their reward is right here on earth. They don't want to go to heaven and get any reward. They want it here. No air condition, no service. No car, no service. A doctor must behave like a king. Please, we beg you, be patriotic.
Thank you so much for watching. Kindly don't forget to like, comment, share and subscribe. Stay safe till we meet in the next one. I love you and it's bye for now.